Chapter 28, Reproductive System, Screencast 6. This is the final screencast for this chapter. We are now starting off with the penis, and basically we have formation of the external genitalia with the scrotum. The root, this is the internally attached portion of the penis, forms the bulb and crus of the penis, and crus attaches the penis to the pubic arch. The body is the elongated, movable portion, and the glans is the tip of the penis and contains the external urethral orifice. There is the prepuce or foreskin, and this is the circular fold of skin attached to the raised edge of the glans. There are three cylindrical erectile bodies within the shaft of the penis. They are ensheathed by the tunica albuginea, and it provides attachment to skin over the shaft of the penis. There is the paired corpora cavernosa. These are located dorsolaterally, and they terminate in the shaft of the penis. There is also the corpus spongiosum. This is ventral to corpora cavernosa in midline, contains the spongy urethra, and also continues within the glans. Now, when we look at the male sexual response, first there is the excitement phase. This is when the erectile bodies of the penis are composed of venous spaces that are surrounded by arteries. The blood fills the venous spaces during excitement. The erectile bodies become rigid, resulting in the erection. This compresses the veins, draining blood from these venous spaces, and blood is unable to leave the erectile bodies until the excitement phase is over. Now, keep in mind, parasympathetic innervation causes local release of nitric oxide, so parasympathetic activity is responsible for the actual erection and the increased blood flow to the penis. Near the end of this phase, we see an increase in heart rate, blood pressure, and respiratory rate. There is the orgasm. This is the intense pleasure, tension release, and the expulsion of semen. The ductus deferens moves sperm towards the urethra. The accessory glands are secreting seminal fluid components. They combine with sperm to form semen. The internal urethral sphincter of the bladder is contracted. This is to make sure that no urine enters the urethra during this time. And there is ejaculation at the end of the orgasm phase. And semen is expelled from the penis with contractions of muscles within the urethra. And keep in mind, ejaculation is due to sympathetic innervation. So parasympathetic is responsible for the erection, and sympathetic activity is responsible for ejaculation. Now, there is a resolution phase, and this is the period of intense relaxation. The sympathetic division is stimulated to contract the central artery of the penis, stimulated to contract small muscles around the erectile tissue. Both help expel the engorged blood. Penis now becomes soft and flaccid. This is actually followed by a refractory period, and this is a period in which no erection is possible. This actually can last from minutes to hours, and it increases with age. Now, puberty. This is the period in adolescence where reproductive organs become fully functional. It is also the time in which external sex characteristics become more prominent, examples being the enlargement of breasts and pubic hair growth. Timing of puberty is impacted by genetics, environmental factors, and health of the individual. The initiation of puberty is due to the hypothalamus beginning to secrete gonadotropin-releasing hormone. This, in turn, stimulates the anterior pituitary to release follicle-stimulating hormone and luteinizing hormone. Prior to puberty, the levels of these hormones have been especially low, as has been the sensitivity of the receptors for these hormones. Upon the release of follicle-stimulating hormone and luteinizing hormone, this stimulates significant levels of sex hormones. And now we actually start the process of gamete and sexual maturation. Now, early signs of puberty development include breast bud development in girls, pubic and axillary hair in boys and girls. Menarche occurs about 2 years after first signs of puberty, and this is the first menstrual period. Boys with testicle and penis growth. There's a rapid growth of laryngeal structures within the boys, and this causes voice to change and become lower in pitch. The timing of puberty, typically girls enter puberty 2 years prior to boys. African American girls actually 1 year earlier than Caucasians. Onset has dropped with better nutrition and health care. About 8 to 12 for girls and 9 to 14 for boys. There is a condition known as precocious puberty. This is signs of puberty developing much earlier than normal. It may be without known cause, or it may be due to brain injury or a tumor in the pituitary or the gonads. Now, the last phase is menopause, and this is in women. First is perimenopause. This is the time near menopause, and it first presents through irregular or skipped periods. Menopause, this is when women stop monthly menstrual cycles for a year. This occurs between the ages of 45 and 55. It results in atrophy of the reproductive organs in breasts due to the reduced hormones. There is a decrease in the vaginal wall thickness and shrinking of the uterus. Now, hot flashes are symptoms that are associated with menopause, and these are a periodic elevation in body temperature. There is also a thinning of scalp hair and an increase in facial hair. What is really important during menopause is there is an increased risk of osteoporosis and heart disease, and this is due to the lack of ovarian estrogen. Now, symptoms may be treated with hormone replacement therapy, but many physicians are no longer prescribing this due to the relationship between this type of treatment and an increase in breast cancer. Now, there are situations where these symptoms associated with menopause are so severe that they will find the lowest dose of hormone replacement and administer it for the shortest time as possible to alleviate the symptoms that are associated with menopause. Now, there is some evidence of what they refer to as the male climacteric, and this sometimes may be referred to as male menopause. And what happens, men have a decreased level of testosterone starting in their 50s. This is due to a decrease in the number of interstitial cells. The decline is more gradually than when observed in the drop of hormones in women. Most men have few symptoms. Some may have mood swings, a decreased sex drive, and they may also experience hot flashes. There may be enlargement of the prostate. As noted previously, this is experienced by most men with age, and it may interfere with sexual and urinary functions. Now, also, there is erectile dysfunction and impotence, and erectile dysfunction is the inability to achieve or maintain erection, whereas impotence, which is associated with aging and other risk factors, is quite often associated with sperm not capable of fertilizing an ovum.